So folks, yeah, chime in the chat. I'm going to do this slide for us here and then turn things over to Maureen for a little bit. So my name is Wyatt Schrader. I'm with an organization called Agnew Beck, and we do consulting on issues of community development and also community health. So everything from behavioral health questions and concerns to urban planning for our cities and our municipalities to the issues like affordable housing and homelessness of what should we be doing, what should we be doing as a community, what should we be doing as a provider network, and what should we be doing as people. So we work on any number of issues, but today we're exclusively talking about homelessness. And I am joined by Maureen Brewer, who is the Our Path Home administrator. She's housed at the city of Boise, and she is running this partnership that we're going to talk a lot more about. Our Path Home is maybe a familiar name to a few of you as the partnership working to end homelessness in Ada County. Maybe it's less familiar to a few of you. And so we'll speak more to that in a little bit. So Anne is jumping in, but we'd love to know who's in our audience today. So please include your name, any affiliation that seems appropriate for this conversation around homelessness. And also, Maureen and I are very chatty people when Zoom allows us to be. And so we love to hear your questions. So please chime in. If you hear something that strikes you in both a positive and maybe a challenging way, chime in with a question, a comment, with a thought or reflection in the chat. We'd like that to be really active. Maureen, can you chime in and say hi? So when thinking about housing and thinking of specifically about the issue of housing instability, it's kind of an ongoing conversation of how best to break this down. There's a lot of very specific lived experiences that each of our families, each of our households, each single adults and kids go through. And so one way we kind of break that down on a very simple view is by thinking about who's stable in their housing, who's at risk of losing their housing, and who's actively unhoused. So by thinking about our entire community, this is our way of kind of simply breaking this down to more digestible chunks. So the numbers you're seeing in front of you is for Ada County in 2018. So we think about those three tranches of housing, stable, at risk, and unhoused. In our community right now, we see, and with the new census, we can obviously get some new information on this, so it'll be interesting to see how these numbers might change. But we see roughly about 72% of our community is stably housed. So people are in their housing, probably have a lease or a mortgage to their name, but your mind probably went immediately to the next two questions.
Wyatt, I think I'm on just through the phone. Can you hear me?
Yes.
Yay.
Maureen, hi.
Okay, I'm joining by phone. I'm sorry, you guys.
Well, it's good to hear from you, Maureen. I'm just going to keep talking on this slide and then hand it back over to you, if that's all right.
And then I can pick back up. Go right ahead. Sorry to interrupt.
So 27% of our community, if you think of almost, 3 in 10 folks are at risk. And by that, we mean they're at risk of losing their housing. Does that mean they're going to show up in shelter tomorrow? Not necessarily, but they're at the very least unstably housed, informally housed potentially. They might be couch surfing today. They might be one paycheck away from losing their rental. They might be at risk of being evicted. Any number of things might be going on in their lives. But then less than that, focusing on that last thing, less than 1% of our community is unhoused. They're actively experiencing homelessness. And from here on out, I'm going to turn over to Maureen in a second. That's where our focus of our conversation is to go. It's not that our Path Home doesn't care about those who are stably housed or at risk, but we don't really focus in on the issue of that less than 1% who are experiencing homelessness. And so with no further ado, Maureen Brewer, what's our Path Home?
Hi, everyone. I'm so sorry about that. I go figure that today when I am presenting via Zoom is the first time in 8 months that it didn't work for me. So let's see here. I'm assuming, Wyatt, is that you playing with our presentation here? Or is
Yes.
that me? Okay, sorry. I'm just getting myself reoriented. Sorry, this is a mess. So I think I heard Wyatt share that I am the administrator of the public-private partnership working to end homelessness in Ada County. Technically work for the city of Boise, but do want to stress the nature of our work. We serve countywide and involve a number of different partner agencies, and we've got a slide on that later if you're curious about who's involved. Really the crux of what pulls us together as a partnership is the fact that we use one prioritized queue, and we have an agreement, a memorandum of understanding that our partner agencies sign to receive referrals from that queue. And essentially what that means is that we are serving the most vulnerable first. The way we define the most vulnerable is by the severity of their service need and by the length of time that they have been experiencing homelessness. We have a finite set of resources, so unfortunately it does mean that we have to prioritize, and we want to make sure that we're enabling some problem solving and the resiliency of households that maybe don't need as intensive of an intervention that we can offer to those at the top of our queue. Next slide, Wyatt. Thank you. So this is some basic data, some basic numbers around homelessness in Ada County. We tried to pick some that were descriptive of sort of what's going on currently. Obviously, these numbers shift, and we have a tremendous amount of information around who and how many are entering the system, and then what their pathway through the system looks like. Essentially, how long does it take us to serve them if we are able to end up serving them? So these are just a few key numbers. As you can see, we had nearly 300 families on our queue in September and almost 500 adult-only households. That number shifts all the time. And quite frankly, we lose track with some of the households on the queue. For example, if they're able to figure out their own solution, they don't always call us back. So we leave them on the queue until we're able to follow up with them. But that is to say that at times the queue can get a little bit stale, particularly between times that we're able to scrub it, if you will. And I don't mean to use a dehumanizing term, but more so, are we able to get in touch with, hundreds of households and kind of find out, keep track of where they are in gaining housing again. The other kind of two bullets I want to point out here on this slide in particular is that one, most of our households experiencing literal homelessness, so they're sleeping in emergency shelter or sleeping on the street, actually do have an income. And I think this points to some of the pressures that the homeless services system feels and experiences from policy decisions that are outside of our control, so lower wage jobs. That being said, 91% of them, so an incredibly significant number, are earning 30% or below the area median income. Homelessness in Ada County, the numbers have actually stayed relatively steady until probably COVID, when we were starting to see a little bit of a blip, a little bit of an increase, presumably because of the effects of the pandemic we're all living through. So to that end, we as a partnership, our vision is to keep households safe, healthy, and housed. You can go back to that slide. Thanks, Wyatt. And the premise, the sort of service philosophy is that without housing, households can neither be safe nor healthy. So you've got to have that housing in place to achieve our vision. One way that we measure that then, so how are we doing in achieving that, is a concept called net zero. This term gets a little bit wonky. Are you able to go to the next slide, Wyatt? So this term gets a little bit wonky, but the basic idea, I'll let you all absorb this a little bit, is that we are preventing more households from entering the homeless services system in the first place, and then scaling our capacity of the system to basically bringing it to scale. So the number of households that are entering the system equals the number of households that our system has the capacity to serve and house. And we want to be able to do that within 30 days. I think everybody can recognize that we will never be able to prevent every episode of homelessness, but when it does occur, we want to make sure that we're able to respond in such a way. Next slide, Wyatt, please. We want to be able to respond in such a way that is coordinated, that is quick, and that offers the supports needed to regain stable housing. If I was to give our partnership a grade, I think we're doing these things well to varying degrees. Certainly we're hamstrung by a lack of resources. However, this sort of three-pronged approach with this kind of goal in mind, that we be coordinated, that we respond rapidly and supportive, and that we're doing so in a supportive manner, is really the goal that we're walking towards to achieve net zero. So I think that's the end of my slides for just a second. Or maybe there's one more, Wyatt. I apologize, you guys. The technical difficulties really threw me off. So Wyatt is going to kind of walk us through what it means to be coordinated, what it means to be rapid, what it means to be supportive, and do that in such a way that empowers households to regain housing, that gives them sort of the supports they need to stabilize in that housing. And then hopefully we move our entire partnership further upstream so that we're preventing trauma further upstream and not allowing households to sort of languish, if you will, be it in shelter or if they're sleeping on the street.
Great, thanks, Maureen. Yeah, so ending family homelessness, I think, we put this little math equation up there, but I think, understandably, when you hear something that big, that bold of a vision, you get a little skeptical. You say, okay, hold on. How can you get inflow to equal outflow for a system? How can you successfully move to get a family housed in 30 days? Well, let's break down a little bit some things that we're working on, and we want to leave a ton of time for questions. And two folks already sent in questions ahead of time, which we appreciate, to get to some of the logistics of this. So let's walk through this vision: finding home, empowering individuals and families, and investing upstream. But let's start by putting ourselves a little bit in the mindset of a household who is experiencing that housing instability. So if we go back to thinking about stable, at risk, and unhoused, that we talk about these in three very neat little buckets, but the reality obviously is that a family or a household could potentially move through these, right? Could experience all of them. And so we have to kind of break down how we target our services as our path home. What we mean by it is this: if you're currently living in housing, but it's maybe your job is a part-time, maybe it's seasonal, maybe you're not making a ton of money, maybe just the household budget, the numbers just don't work out always. You're probably what we call housing unstable. Housing instability is your experience. Now, there's things we can do to help. But where we can help is that's really, really far upstream, and we call that universal prevention. So you might be talking to like a school counselor if you've got school-age kids. And maybe you're not talking directly about housing. Maybe it's more, well, housing is one of my budget problems, but also my car broke down. Is there anything we can do about that? Or actually food is an issue that we have. Can we work with the food bank? So universal prevention goes really far upstream to make sure you stay stable and stay in housing. But if your experience goes to that next level and you actually lose your housing, you move off your lease, you'd be surprised, and we're going to talk about this here in a second, like how much can actually happen to prevent you from having to go to shelter. I think in our minds, we think there's a very neat one-to-one ratio of if someone loses or gets evicted, that they immediately walk to shelter that next day. That actually very rarely happens that way. And here's why. Because with loss of housing, we get very targeted prevention. That targeted prevention tries to specifically target probably around eviction court and saying, how can we make sure that, one, you don't get evicted, and two, if you do get evicted, that doesn't necessarily mean that you have to experience homelessness. There's a lot we can do in that space to keep a formal eviction off your record, which is a huge barrier for a family, not just in the short term, but in the long term. And again, making sure that they don't necessarily have to show up in shelter. But the families themselves, the households themselves, also are able to triage. They are resilient, as Maureen just said in the chat. And so a lot will try to solve their own problem. And maybe if they don't get back on a lease, they experience what we call being informally housed. These are the couch surfers, or hear them called. They're being doubled up, which is having multiple families under one roof. Targeted prevention can also work for these folks as well, because again, we can problem solve with them to add maybe some clarity to their creativity to their conversations, so they don't have to experience homelessness. But then we can't prevent everyone, as Maureen said. And so some people will literally start experiencing homelessness. And at that point, we still try to rapidly get them back into housing with something called rapid resolution. Some people can only experience homelessness for maybe a month or so, and then we can get them back in. But others will need something a lot longer that we call supportive housing, which we'll talk more about here. So, finding home. Whether you're a veteran, whether you're experiencing chronic homelessness, whether you're a family, whether you're a single adult, there's a philosophy of trying to get you back in housing that I'm sure some of you have heard. It's called Housing First. We've actually made some huge strides, and maybe it doesn't always feel like it, but as a country, we've made huge strides in ending homelessness around the country. Veterans homelessness is probably the shining star of that work. There's a lot of foundations and governments that have come together to say, if we target specifically a population, would it be different? Because maybe veterans need something that's a little bit different than what youth need or what families need. And they use this philosophy called Housing First, which is saying very, very simply that if you want to be stable, you need to have housing. That's not a radical thought. But the way that we've approached it for generations in our country is by saying that you only got housing when you showed that you were ready for housing. And so the narrative will work out this way. If I was working with Maureen, I'd say, Maureen, your job isn't stable enough, so we're not going to house you yet until you get that job stably enough. Or let's make sure to get you on a treatment plan, then we can stably get you housed. We would have all these conditions before you would get into housing. And from a case management perspective, or, Anne could probably talk to this a lot, from like a behavioral health perspective, it wasn't terribly effective. Because if I'm exiting you from my clinic back onto the street, it's a lot harder for you to stay clean. If I'm exiting a child every single day at the end of school back onto the street, their education usually is a lot harder to stay up on. But if we get you housed, and if we maybe help pay some of that housing through rental support, then what happens to your education? If we're exiting you back into a home, what happens to your behavioral health outcomes if or you have a treatment plan and the clinics are exiting you back into a home? Then case management is showing it's a lot more effective. And so that's what Housing First is, the philosophy we use for all populations. You have to individualize it still. It's not a one-size-fits-all approach. It's very targeted towards an individual case. And it's one of the main reasons that Our Path Home sees such success. Less than 10% of households that have been permanently housed by Our Path Home come back. Less than 10%, which is huge. I'd be curious to see if that's surprising for folks. So this idea of supportive housing, stable housing with your lease in your name and supportive services, what we call supportive housing, it works. And it works because housing is health. Now, this is something I think homeless advocates have been saying for a long time, but I think and maybe Maureen, you can reflect on this too. During the time of COVID, I think people are getting this in a very, very loud way. Folks like myself who had never worked from home a single day of his life until COVID happened. Now we're all having to realize that, wow, if I want to stay healthy, I stay in my house. Well, what about someone who doesn't have that opportunity tonight, who is sleeping in a congregant shelter tonight? Do you have the same opportunities? So if we focus on housing and stable housing, long-term housing with supportive services, we can prevent and reduce trauma to children, to families, and to people. So if that's finding home, second part of achieving our vision is empowering individuals and families. These are supportive services. I've already started to touch on this, but we've got every single agency from Catch to Jesse Tree to Sanctuary to the Housing Authority has a team of supportive services coming alongside these individuals and families. Throughout my entire career, I've always had this comment and question of housing first, but if it's housing only, Wyatt, this will never work. And that's exactly right. We need to give supportive services that walk alongside people. And so two ways that we look at that is being what we call trauma-informed and being strength-based. Trauma-informed means recognizing that that person has a lived experience that you needed to calibrate your service plan to. Living in shelter, living on the street, living in doubled up circumstances is really traumatic. And so A lot of case managers, I think, will tell you that sometimes that first month when they're in housing, you're not going to really go too deeply in your case plan because they're just living into a house for the first time, potentially in a long time. And there's a lot of like trauma and even living under a roof again that a lot of people have. New Path Community Housing downtown, we saw that there was one person who didn't sleep in their bed for their first month because they weren't comfortable in that bed because they hadn't had one in so long. So that was his way of having a trauma response. That's okay. We can be responsive to their individual journey and being strength-based of recognizing, just like Maureen said in the chat, that everyone has strengths. Everyone deserves housing. Everyone can be stable. So let's approach it from that level of positivity and work backwards to what you need today. Maureen, do you want to say something?
Can you hear me?
Yes.
Okay, I was just going to add, yeah, especially regarding this idea that housing equals health, and they sort of said it in the chat, but I think COVID for the first time brought sort of that concept, sort of a mantra that we've been saying as a homeless services system for a very long time. But I think for the first time, it made it real to community members that were asked to literally shelter in place. And that same opportunity isn't afforded to households experiencing homelessness. So quite frankly, responding to the pandemic has brought our partnership together in a new way. And I think also offered an opportunity for our community to understand homelessness and that link between housing and health in a way that was really concrete as opposed to conceptual.
Yep. That's great. So that last stat, Maureen shared it earlier, 78% of the folks that we see coming through our path home are experiencing homelessness for the first time. That speaks to a number of things. One, it speaks to that housing is difficult right now. Wages aren't growing. There's a lot happening outside of this partnership that this partnership can't necessarily control. And so a lot of people are, and I'd be curious people's reactions in the chat of that 78%, how do you react to that? Is that a good number? Is that a number gives you some hope? But it does speak that if we invest upstream, we think we can do an even better job of making sure people don't have to come to shelter. And so what you're seeing here is true to that slide from a little bit ago. To end homelessness, we need to prevent it whenever possible. We need to go upstream into eviction court and prevent and serve folks in eviction court, which we're having some great partners. Maureen's been leading a work group specifically to look at this question, which is a new thing for our path home to finally have an answer to prevention. And we're getting some, I think, already great results out of that. And then hopefully doing even more of this informally housed. I don't think we do, but if we had any folks who worked in our school districts, this is where they start saying, amen, make the term informally housed larger in your slide, please. Because they're seeing this every single day. Our school districts see these doubled up populations, and they're always asking, like, why is the federal government not doing more? Why are we not doing more? And so I think the partnership is now getting to that level. It's like, okay, it's now we're at a maturity level and a scale where we can finally look at informally housed to see what we can do to make sure they don't have to come to shelter. And we've hit on this a couple of times, but there's the last bullet of just recognizing there's a lot going on to affect homelessness: childcare, the minimum wage, affordable housing, childhood trauma, education. There's a ton that goes on that impacts this work. It's not just, unfortunately, as simple as our rental assistance and supportive services. We wish it would. But to end homelessness, we're also going to need to make sure we have partners outside of the homeless service system that are looking at these huge systemic challenges too. So with that, Maureen.
Yeah, I'm going to give you guys a little bit of a sneak preview into one of our strategic initiatives, which is a campaign to end family homelessness. I also wanted to make one more comment on what it means for us to invest upstream, because we want to do that, and I think Wyatt said this already, but we want to do that in a targeted manner. In other words, we want to make sure that we are using very limited homeless services resources to intervene with those households that are the most at risk of sleeping in an emergency shelter or sleeping outside. The challenge and kind of the tension point is that if we overinvest in what we call, again, sort of a jargony term, but universal prevention, if we overinvest in that, what we end up doing is spending a lot of money and a lot of resources on households that were never going to access the system anyway, and then in effect diverting those resources from the households that need them the most. So there's a balance there that we're still exploring around where within homeless prevention, quite literally, where do we want to show up? We want to show up in eviction court. We want a response when somebody calls our housing crisis line and says, hey, I'm going to be in the emergency shelter tonight. We want a skilled staffer to engage in a problem solving conversation with them, and to have access to some financial resources to make sure that doesn't happen. What we don't want to get into, and some of the COVID response, with good reason, has gotten into this, but is paying rent or back utilities or those kinds of interventions for anyone that calls and says, hey, I need some help. Certainly, we don't want to deny a service, but we want to engage in a really deliberate problem-solving conversation and refer out to other community resources so that burden doesn't come to the homeless services system. And so with that kind of tee up, we are in a position, our Path Home is in a position and has an incredible opportunity, quite frankly, one that no other community in the nation has done yet, and that is to end family homelessness. And people get a little bit freaked out by us using the term end, but that's what we mean. We mean that concept of net zero. We mean that if a family does experience homelessness, that we're able to respond and we are able to connect them to a housing intervention and the appropriate set of support services right away. So to that end, I guess it was last year, it's 2020 is such a blur, right? So I think it was 2019, we did a feasibility study to see, kind of take the temperature of the community. Hey, if we tried to raise money for this issue right now, is there a community appetite to contribute? We did a cost study so that we knew kind of ballpark, I will say, what kind of investment would be needed to end family homelessness. And then to that end, came to the conclusion that yes, this is feasible. Yes, the time is now, despite the fact that we're in the middle of a pandemic. It might even be more critical that we launch this campaign now. So we brought together a leadership cabinet that's helping put together some lead gifts as far as fundraising goes. And then we also have a solutions implementation team that Wyatt is helping out with, of our core providers that are taking a long, hard look at our system and doing a little bit of a system redesign and saying, hey, what does our ideal partnership look like? And what are the action steps we need to achieve that? If I'm a family experiencing homelessness and I call and say I need help, how should we be intervening with that family? And my hope is that we are able to translate what we learn and what we implement on the families with children side to the adult-only side as well. Wyatt, do you want to go to the next slide for me? So I want to show you what this looks like. I will say that the lines here, the trend, if you will, is more important than the numbers themselves. But if we assume that there's about 180 families on our queue or in need of a housing intervention, this graph sort of represents, here's what happens, top line, if we just stay the course and do what we've been doing, invest what we've been investing, as opposed to what if we invest more, invest it strategically and intentionally, how quickly can we achieve net zero? And so that's sort of the 5-year trajectory that we're looking at. And then Wyatt, if you go to the next slide, this is what we're looking at investment-wise. So I think what's so interesting, what I want to point out to you is that there does come a point in this model, it shows that this point happens in year 4, where we're investing a little bit more than we might have otherwise, but then you see it drops back off again. And that is because, and this, follows logic, but that is because the interventions that we can deploy, if you will, further upstream cost less. They cost less financially, and then they cost less in terms of case management and, quite frankly, the experience itself, because the longer we allow you to sort of languish in emergency shelter or allow families to sleep in their cars, the more trauma they're experiencing, and then the more support services and rental assistance are needed down the line. So Wyatt mentioned that supportive housing is effective, but wouldn't it be nice to get to a point where that isn't the intervention our families need because we're able to catch them earlier? So we're looking at an overall investment of about $8.4 million. And right now, like I mentioned, sort of working with that solutions implementation team to say, okay, guys, we have an infusion of resources coming in. What's our best day for how to spend those dollars? What's the most impactful way to do that? Next slide, Wyatt. So these are some of the key partners. These partners, a handful of them are specific to families with children, but this also represents some of the partners, generally speaking, that also serve adult-only households. We kind of threw in the graphic at the top because there's going to be, I think, a pretty thorough and purposeful community engagement piece, and you all are a part of that solution. So look for that in the coming months. And is that our last slide, Wyatt? I think it is. So we can sort of answer any questions you have, or otherwise just have a discussion.
Well, Maureen, I've got 2 questions for you that come from our app. And I think they're both great for you. So Maureen, let me ask you this. How has New Path, if you want to explain what that is, maybe some folks who don't know, and other recent developments for chronic houselessness impacted our local situation? Have we noticed a difference now that we have New Path and Valor Point? And also, what are those 2 things?
So New Path Community Housing opened in November 2018, right? 2019. Again, with the years blurring. We just did our 1-year evaluation. So we opened New Path, and it's 40 units of what we call permanent supportive housing. And we took the 40 most vulnerable people that we could and housed them there. And then they've got support services on site. We have what's called an assertive community treatment team on site at New Path. So there's 24/7 staff there. And then we took that model and did it again for veterans that qualify for a VASH voucher that are also experiencing literal homelessness. We just leased up Valor Point in August. It's 27 units, 26 of which are for chronically homeless veterans, and then there's 1 live-in manager's unit. And on the one hand, if you looked at it from the lens of what is left to do, it might feel a bit like a drop in the bucket. However, I will tell you that adding 66 units of housing dedicated to those that are experiencing chronic homelessness was incredibly impactful. I remember one of our shelter directors right after we leased up New Path was like, wow, Cooper Court is completely different. There was a noticeable difference on the street, if you will. And I mean, when you're looking at numbers like we are that are in the hundreds as opposed to the 60,000 people sleeping on the street in Los Angeles, 66 units really counts for a lot. They were both expensive projects. One of our challenges with New Path on an ongoing basis is a sustainable fund source for that ACT team, the support services staff that are there. We didn't have that problem at Valor Point because those vouchers, those VASH vouchers, actually come with case management alongside it through the VA. So certainly impactful, but there is a willingness and momentum, I think, to do more. And we certainly need more projects like New Path and Valor Point. We also need more units that we would call, or that are sort of in a scattered site model. So they're units across the community that also offer permanent supportive housing. So there's a case manager that walks with that client and helps them maintain their housing, and then we provide the rental assistance. So I will say most of the families with children on our list don't need a permanent intervention. They need some help to get back on their feet. They need some stability supports, and then they can transition. Most of the adult-only households on our list need something, a longer-term subsidy, and for many of them, that will be for the rest of their lives.
Maureen, I think you're already hitting on this, but the other question was, all right, we took this, Valor Point took a targeted approach for veterans. What other demographics can we target? And you already mentioned obviously targeting families, but do you want to talk about other strategies within there in terms of this demographic approach? Because I feel like that's also like a new way of thinking potentially for a lot of folks, of thinking, well, families might need something different than veterans, who might need something different than single adults.
Yeah, and certainly they do. I mean, by and large, not to oversimplify it, but Wyatt, you've said this before. If a first grader, if my son, if I were to ask him, hey, if somebody doesn't have a house, what do they need to get back in housing? And they would say a house. And so we tend to, once it moves out of a concept, kind of overcomplicate it as adults. But regardless of the subpopulation, my point is they need the same things. And if we went back to that chart, Wyatt, that table that you kind of walked everybody through, the interventions actually look the same. We call them different things based on when they get applied. But what's needed is some financial assistance and some support services. And it's just a matter of where and when and for how long those get applied. So chronic homelessness is a subset of the population that we're looking at, that we're addressing and planning for. Certainly New Path and Valor Point are examples of that, and there's a need to do more. We also have to sort of play, depending on what subpopulation that we are trying to advance a solution for, there's different partner agencies, there's different fund sources, there's different, opportunities, if you will, for them, depending on that subpopulation. So one of my hopes, one of my plans for addressing chronic homelessness specifically is to create, now that we've done the proof of concept through Valor Point and New Path Community Housing, is to create essentially a project pipeline and make an action plan around, okay, well, here's the impact that had, here is the cost avoidance associated with it, and now what can we do next? And then what's the plan for the next? And what's the plan for the next? So I think that is coming, specifically in terms of chronic homelessness. And then, like I said earlier, with our redesign of the system on the family side, there's no reason necessarily why we couldn't pick that up, if you will, and then go apply it to adult-only households, which is largely the two categories we're sort of working within: families with children, and then either single adults or couples without kids.
Yeah, I think that's an important thing to keep in mind. If, like some of the family homelessness work has been in the news and probably will be in the next couple of years, like that's not, and it's, even though it's got this public face to it, a lot of that also has to do with just with philanthropy. Maureen mentioned a number of about roughly 8.5 million can help us end family homelessness. It's probably not, unfortunately, the same size of number of what's going to make a difference for our single adults. And so there's just very different strategies we're going to take from also a funding standpoint and a collaboration standpoint. And so if you hear stuff about family homelessness, doesn't mean our path home isn't focused on those other populations. It's just, that's a very public and kind of ready to go approach right now. All right, so Jane's got a question. Maureen, I'm just going to be a question person. Is that all right? I kind of like this.
Okay, yeah, sure. Unless I don't like the question. I'm just kidding.
As Maureen mentioned earlier, I mean, she talks to adults. I'm more comfortable talking to first graders. So Jane asks, which also Jane's good to hear from you. Can you talk about the collaboration between municipalities in the Treasure Valley?
Yeah. Hi, Jane. We're still working on it, to be frank. I think we've made some inroads at the county level that weren't there before. and I give a lot of credit to Commissioner Laciondo for that. We regularly collaborate, I would say, with the city of Meridian, but haven't quite found our groove in terms of what role can the city of Meridian play and what can be their contribution. The fact of the matter is there's no shelters in Meridian. So for folks that are experiencing literal homelessness, that are sleeping outside or in a shelter, most of those folks are in Boise. However, it would be a myth to go ahead and assume that homelessness doesn't exist outside of Boise city limits. Of course it does. By and large, people are doubled up. However, you will find campers throughout Ada County. And we have a fledgling, a new street outreach team. Again, truth be told, right now, they're new, they're in their infancy, and they're a small group. There's just 3 full-time staff, and it's hard for them to get out of the Cooper Court downtown core because the need down there is just so great. But we know from some of our other providers within that street outreach network, Ada County EMS is an example, Ada County Sheriff is another, that certainly there are people experiencing homelessness in the municipalities around Boise and throughout Ada County. We owe it to those municipalities to continue to try to engage with them and try to educate them around literal homelessness, yes, but also around this idea of housing instability and housing loss. Because that's happening in Meridian, it's happening in Star, it's happening in CUNA, and costs also affect this. The agency that Wyatt used to be the executive director for, Catch, they have a rapid rehousing program for families, and we're housing a lot of families outside of Boise because of cost. So those families that are at risk, those families that are experiencing housing instability, I know you understand this, Jane, they exist throughout Ada County. And so this idea that sometimes gets floated that, oh, this is a city of Boise problem, is a bit of a myth and something that we need to continue to educate other municipalities on.
Yeah, I think that's especially, there's a wonky answer, but I think it leads to maybe a frustration among some people I've chatted with over the years of Canyon County is also in it. So everything we're talking about here is Ada County. It's why Maureen's so hyper-focused on that, because that's the nature of Our Path Home. It is an Ada County collaboration. And so Canyon County is kind of its own view of homelessness in terms of the collaboration right now. And if I can say it bluntly, there just isn't a lot of collaboration happening now out in Nampa, out in Caldwell just yet. There's not the same level of services. And I think that's definitely a frustration for a lot of service providers as well, who are working across the entire valley. And for families, they're just having to triage their own situation. So I think there's definitely more to do. And I think Maureen keeps saying this, and it's 100% true of, well, what we do in Ada County can be a model for other places, including Canyon County. And so it's not those conversations aren't happening. It's just maybe they're happening at different speeds. And so anyone here who's working in Canyon County, nothing we're talking about here isn't replicable. And so if there's people that need to sit down with the mayor, with Canyon County commissioners to kind of ratchet that up, I think it's an evergreen need.
Yep. I mentioned earlier too that COVID has our partnership working together in a way that we never have. We had these relationships established, but we never had reason, quote unquote, to be on the phone with our hospital systems on multiple times a week for months. And so a cool thing that's come out of that is, one, that's strengthened our relationship with the hospital systems and some other partners too, FMRI being another one. But Canyon County, to Wyatt's point, has seen what we've been able to do in response to COVID to protect our homeless population here in Ada County. And we've extended that through Canyon County as well. So we're helping them problem solve locally to the degree that we can. But for example, they have not been able to stand up a hotel for folks that are either at risk of well, the entire homeless population is at a greater risk, but some of the more medically fragile, most vulnerable, and then any of those that might have a test pending or have tested positive. So actually one third of the guests, I'll say, that we have sheltered at our hotel for people that are experiencing homelessness and have tested positive for COVID-19, 1/3 of them have come from Canyon County. So it's been kind of nice to sort of reach out and say, hey, we do have this set up. We have a network. They have some funds. We have the partnership. So that's working really well. And I think, with 2020 being the year that it has been, there is some positive coming out of it as far as collaboration goes. And Jean, to your point, what we can get done together, including with our neighboring counties.
Any other questions? What's on everyone's mind? Or maybe it's not even a question, just a reflection on seeing some of these numbers and hearing the updates on what's going on right now. Jane asks, any way we as stakeholders can help? What do you think, Maureen?
Yes. Yeah.
Yes. Next question.
I just had a conversation with an insurance payer this morning about, hey, how can we step in here? Where do we need help? And it will come as no surprise that more than anything, the homeless services system needs resources that are flexible. One of our challenges as we, for example, have brought together the solutions implementation team for the campaign to end family homelessness has been, one of the things that sort of hamstrung us has been the majority of the resources that we have to sort of deploy are federal, and they come with just a whole host of regulations and eligibility criteria. So we spend a lot of time, unfortunately, telling people they're ineligible for one technical reason or another, and it doesn't feel very good. So flexible private dollars are a huge deal, and they're a game changer. To be fair, I think our partnership owes it to these types of funders and philanthropists to demonstrate what the impact is of those dollars, and I think we're getting better and better at that. But I also think, I said that we had a fledgling street outreach team, but the partnership in some regards is too. We have made massive strides in the last 3 to 5 years, but we certainly haven't arrived at a place that we feel comfortable stopping, right? We have to continue to evolve. There's more for us to do. We can continue to raise our level of sophistication, and I understand that. However, I do think stakeholders can help sort of promote what's happening, that there is a lot going on in a really thoughtful, strategic, systematic way, at least in Ada County, around homelessness, and to sort of help spread that message and help us educate the public and educate them around the fact that we can't be the answer for everything. So interestingly, and I'm making this a very long answer, I apologize, but we're going through a training with the National Alliance to End Homelessness, and we had a school district social worker, and this was her word, not mine, but she just said, I'm so ashamed because I've been making these referrals for families to emergency shelters thinking that they were going to offer them a service that I couldn't. And so it's just been really interesting, not that I want anyone to feel shame, more so that, hey, that we have an opportunity as a community to problem solve upstream rather than, passing the buck downstream, if you will, because there is no, I say that we have a queue, and we do, but we are not able to serve everyone on that queue. And so I've said this a couple times too, use this phrase that allowing people to languish in homelessness cannot be our answer. So to the degree that the community and stakeholders can kind of rally the troops to say, hey, let's problem solve this instead of sort of passing the buck. That's super helpful too.
Can I add one simple thing we can all do? Vote.
Didn't I name this whole thing?
I was gonna say, like vote. This, I think Maureen and I have been having this conversation a lot of homelessness has been always a slightly politicized issue, but especially with our current federal administration, it's becoming even more politicized. And so if we were having this conversation in LA right now, we'd have a very different room, frankly. And so like voting incredibly matters, but also at the local level, we're a small enough town that if you email your city council members and email your mayor and email your county commissioners, they're going to get back to you. That doesn't happen. Like, I'm from Philadelphia. That doesn't happen there. So talking about this partnership and talking about what matters to you is huge. Like a 1-paragraph email to your city council members every other month, you'd be surprised what kind of impact that gets. Because I feel fortunate to be close with a lot of our city council and county commissioners, and you'd be surprised how few emails they get. And if they get emails, they're probably not from Boise. And those go into the trash, and they then assume that the community doesn't need them to do anything. And so vote, reach out, your voice really matters. This is not just a celebrity pitch that you're hearing on every single NBC commercial right now, it's also true. So vote, and if homelessness is important to you, reach out to your local officials.
I would also add to, especially Jane, I'm thinking of you since the question came from you, but one thing that we are starting to try to socialize is how badly we need the partnership. We need partnerships from property managers and property owners. And as if you are a stakeholder, for example, that's a financer in some way on housing development, housing projects, we are desperate. We are desperate for units dedicated to people experiencing homelessness, and we are desperate for those units to be affordable, one, and attainable, two, meaning they have to be a unit that our voucher can sort of make up the difference on as far as rent is concerned. And then attainable, meaning we have clients that have a lot of barriers to housing. And so to relax some of the tenant selection criteria is huge for us. And we have a very, I would say, small but mighty kind of committed group of property managers that we can rely on. They only have a finite number of units. So for us to sort of start getting into some of the market rate developments and getting a handful of units in those really would be impactful. And I'll give you one quick example. I know we're kind of coming up on our time, but we have had a family looking for housing that has some significant barriers. They owe a lot of back rent. You think they've got an eviction on their record. They're a larger family. Anyway, they've been looking for housing for months. So we've had them connected to a program that is offering case management, that's engaging with this family. And we're just having a lot of trouble housing them. And so even when we do make a referral to housing, we've got many families, many households that just can't access housing for one reason or another. So kind of growing those types of partnerships is important for us too.
Maureen and I actually have a 2:30 we need to run to, which is about ending family homelessness. But we've got 10 minutes what other questions have folks got? And unless you just want Jane, we like Jane's questions. Other questions? Even Jane's asking for other questions. I don't see anything on the app either.
Well, thank you very much for those of you that did attend and are listening. And care about this issue, there are certainly ways to engage. And there is a committed group of folks, not the least of which are our frontline staff, and that's not Wyatt and that's not me. But it's the people that aren't working from home right now that are client facing and really working hard with the most vulnerable residents of our community. So thank you for your interest and for your attention too.
I'll just say one last note. It's I know some, including Jane, have heard this. We can end homelessness. I feel fortunate enough to have worked on this issue for 12 years now in many different places. And I've worked in DC and Philadelphia, and you don't have the opportunity that Boise has, that Ada County has, that even the Treasure Valley has. Like, that doesn't exist in other places. The numbers we're looking at are real, and they should give us pause because there are real faces behind those numbers. But they're not so overwhelming that we can't make a huge difference and get to a place where when a family or a single adult comes to our Beth home, we can't rapidly find them housing. So like, don't despair. I honestly believe the only thing stopping us from ending homelessness is choice. We just have to choose to do it and put our egos aside and figure out any number of questions we've got to figure out. And so that's, if nothing else, like believing that, to Jane's questions, for our stakeholders and talking about and socializing that possibility is absolutely huge. Because the more negativity we have on that question, the time is lost before we even start doing that really intensive work. So thank you all for believing that. Thank you for listening to Maureen and I, and hopefully you're enjoying the rest of the interactive. It's good to see everybody.